Jess, it's tendon month at Physiologic, so do you want to tell us a little bit about lateral hip pain today?
Yeah, sure. So lateral hip pain typically presents as pain around the greater trochanter, which is the bony lump on the side of the hip. So generally pain around this area. There are a couple of structures that can cause pain here. So referred pain from the back is a common one. You've got a bursa, which is a fluid sac right around that greater trochanter. And then there's a tendon that runs from your glute muscle into this attachment point here. That's another common structure that can cause pain around the lateral hip area.
Hip pain is something we often see in the clinic. So what are the common causes of a tendon issue in the hip?
A tendon problem in the hip can come because of like a slip or a fall or a sudden increase in activity. But commonly a tendon issue arises purely because of a gradual overload over time. So if there's been too much compressive load placed on the tendon, then gradually the tendon will degenerate, and that in itself can cause a problem gradually over time, so not with a particular incident that you may remember. The common positions that cause like a compressive load to the tendon is hip adduction, so coming across the body, and then flexion with a little bit of external rotation. So things like sitting with your legs crossed, going up a lot of stairs, lying on that side, they're all really common positions that can cause an increase in compressive load to that tendon and then cause some injury down the track.
So what tips would you recommend to help unload the tendon?
If you are having some pain in that tendon or in that hip area because of a tendon issue, a really common tip I like to start with is to avoid hip hitching. So often we get lazy if we're standing for a long period of time and we do this type of motion where we sort of hitch our hip and hang off our hip. In that position, our hip's in adduction, so there's too much compressive load through the tendon. So a really handy tip is, if you are standing and getting some hip pain, to have a look to see where your weight balance is in your feet, making sure you've got 50-50 weight balance in each foot, and that you're not leaning and hitching to one side. So that would be my tip. Make sure that you've got even weight distribution through both of your feet and that you're not hip hitching.
Okay, thanks.